Hi, good morning, everybody, and thank you for joining us. I am here with Chief Badalora, Town Administrator Jim Gilday, and our Regional Health Director Megan Avalone. As you can see, we're practicing our social distancing, so I'm going to make a few remarks and then I'm going to hand it over to these folks to give you updates. I first just want to begin to thank everybody who's offered incredible words of encouragement and offers of assistance during this really unprecedented time. I want to thank everybody for their patience. We are making decisions in real time based upon the information that we get that's available to us in collaboration and speaking to local and state and federal officials as well as other mayors and so forth. So thank you for hanging with us as this information evolves. That being said, I have to say I remain incredibly confident that we are in very good hands here. I think if you guys could see what I see behind the scenes, you would be incredibly proud of the professionalism and dedication of our staff. So I'm only feeling more confident in our ability to manage this, and we promise to be and remain incredibly transparent and forthcoming with information. And I have to say the compassion and generosity from our community, it's no surprise, but really seems always in our times of greatest need is when we shine the brightest. So thank you for all of that and for keeping spirits up. I want to say we have been doing a very good job of social distancing. I've seen it and I witnessed it, but we can still do a little better. Yesterday, there were reports of kids playing on playgrounds in spite of the yellow caution tape around them. So please do your part for this social distancing. Megan will talk a little bit more why that's so critical, and require your kids to do the same. I know it's awfully hard to say no to the play date, to the sleepover, to whatever it is, but now is the time for the safety of our community. Remember the 6 to 10 foot distance rule in all instances. And again, while you may think you are not vulnerable to the virus, while you might think you are not exhibiting symptoms and you must be well, each one of us has an obligation to protect those who are. And I think one thing Megan will also talk about as well is what we expect the explosion of cases, not because people are not currently infected, because as testing becomes available, you're going to see how rampant the infection is already in our community and surrounding ones. And that's not to scare people at all. We are prepared for that and expecting that, but it is just a reiteration that we have to act as if this virus is already very prevalent in our community, and you should be taking the appropriate precautions and assuming that. Today, we want to update you on medical preparedness and status of current COVID cases, town operations, and our emergency preparedness, as well as any questions you may have. We've received several in advance. We're also going to be taking them live here on Facebook, and you can also email them to covid19@westfieldnj.gov. Kim Ford, who's off camera, our public information officer, she can get them in real time and provide them to us as well. As I mentioned, Megan Avalone is here to provide an update on the status of the confirmed coronavirus cases, testing sites, and measures you should take if you feel sick. Town Administrator Jim Gilday, he'll be providing an update on cancellations, town operations, and what measures we are taking to make sure we can continue to serve the public's emergency needs. A full list of public postponements and cancellations can be found on the coronavirus webpage. Chief Badalora is going to provide an update on our emergency preparedness in his role as OEM Director and Police Chief and what his department is doing to help make sure that we can meet those in need of assistance. I also want to acknowledge the elected officials who've been reaching out to offer support and assistance. Yesterday, I got a call from Senator Cory Booker just to make sure to see if there's anything that we needed. I just got off the phone with Congressman Tom Malinowski, and I'm going to give you a few updates he gave me in a second. And I text with Senator Kaine regularly, all of whom are asking for input and what other additional resources that they can provide. In addition to additional medical and emergency equipment needs, much of their support, as is mine, is focused on financial support and recovery for the businesses and displaced employees. And I'm getting a lot of inquiries from residents about that as well. So I do, to that end, really want to thank all of our restaurants who have really pivoted to providing delivery and curbside service. And for all of you that have been continuing to support them, I think I'm doing my part daily. Please continue to support them with your patronage. Many have offered to donate food. I do want to give a special shout out to Adams Tavern. I put them in touch yesterday with the social service director of the county, and they're providing, they're donating several meals and food to social services agencies around the county. If there are any other businesses or restaurants have stock or anything that you need to unload, let us know, and we can connect you with resources also to get those to places in need. Let me just give you a little update on what Tom Malinowski mentioned. Things at the House and the things that have already been done in support of businesses, they have ramped up small business disaster loan program. They recognize it's not enough, but they've definitely ramped that up. In the House, things that are in the House of Representatives, things are already done. They've expanded paid sick leave by 2 weeks. They've extended family medical leave, FMLA reimbursement, and unemployment insurance. They are in the midst of negotiating an economic stabilization package, which they hope to be passing next week in collaboration with the Senate. It's going to be looking for more generous and flexible financial assistance, including zero interest loans, just providing easy access to money. As you probably have heard, there's talk about just distributing cash to every citizen, and that's something that they're working on. And they're also looking at potential conditional industry buyouts. So more to come, and we're going to put Congressman Malinowski and other elected officials' information on our website, and he said that he is a dedicated person to help out businesses and so forth that can help navigate a lot of the federal bureaucracy. Before I hand this over to Megan, I do just need to give a real special shout out to not only the folks that you see up here, Kim Ford, our public information officer. I've been getting very positive feedback about all the daily updates we're putting out. I can't take credit for that. Kim Ford is feverishly working behind the scenes to make sure that we get out real-time information to you. Of course, our Fire Chief, Tony Tiller, our DPW is still at work trying to make sure that they can support needs and taking all distancing precautions. And very importantly, our healthcare workers on the front lines. I've got many emails from local physicians that live in Westfield, basically continuing us to plead and urge the community for social distancing measures. And also, they really are putting their lives at risk. Many of them are living sometimes in apartments in their garages to make sure that they quarantine themselves from their own families. So we just, our hats off and dedication on all of those folks that are working so tirelessly on our behalf. So with that, I'm going to hand it over to Megan, and then after everybody gives their comments, I'll circle back to some of the questions we've already received and any that might have come in the meantime. So with that, Megan Avalone.
Thank you, Mayor. So since last time we met, there have been some new updates I'd like to share with you. The first is now the Centers for Disease Control and Prevention is now recommending that people don't hold gatherings in their home of more than 50 people. But I can tell you from a health department perspective, we are discouraging all gatherings. We are also strongly discouraging against play dates. I know there were a lot of questions that came in last time about play dates, and the guidance coming from the health department today is play dates really should be discontinued. As of Wednesday of this week, all public and private schools have been closed in New Jersey to go along with the social distancing guidelines that we have been talking about. The New Jersey Department of Health website has also been updated to include some graphics and infographics that residents might find especially useful. One of them is a county dashboard, which will update in real time confirmed cases in each county statewide, and also give an update of the state overall cases as well. And then the other thing is a graphic that shows people what their risk is. So it's a graphic that can be found on the New Jersey Department of Health website, and it looks at what your, if you have a runny nose, what's the risk? It may be COVID-19 or a cough with a fever. So that may be helpful in trying to self-triage what you look like, if you become sick. We've been getting a lot of calls in the office from individuals who are sick and are concerned, and that's completely understandable. I want to remind residents that first and foremost, we are still seeing lots of flu in the community. So if you do become sick, I think it's really important first to stay calm. Secondly, the message is the same as it was last week, that we're asking all individuals who have respiratory symptoms, who have a fever, who have body aches, please call your healthcare provider before you show up. Additionally, please reserve 911 for truly life-threatening emergencies. And with the emergency room, if you have COVID-19 symptoms and you feel as though you should be treated in the emergency room, please call before you show up at the local emergency room, and please reserve emergency room use for all true medical emergencies. The other thing that the State Health Department has provided, which I think is especially helpful, is something that they're calling a warm line for mental health services. Certainly in the last few weeks, we've all been under tremendous stress and anxiety. But this is a hotline, a warm line, as they're calling it. If you need to talk through some specific situations that you're going through, or just looking for mental health resources, the line is available 24/7, and the operators are multi-language, so they do have capacity for other languages other than English. That number I'd like to share with you is 1-877-294-HELP. Again, 1-877-294-4357. I think that's about all that has really changed since last time that we met.
We good?
Yeah.
Jim?
Yes. Thank you, Mayor. And thank you for everyone joining us today. Again, this is surreal times. Town Hall, the public center of the town, is closed to the public. And yet we have staff here, very, very skeletal staff in many of the offices, being able to answer their phones, answer emails, process mail that's coming in. So a couple of reminders. So it was this week that we actually closed Town Hall to public access, with non-essential and skeletal staffs operating for various purposes. People can work from home, some cannot, but out of separation needs, we're having them be at home and take different shifts in various offices. The residents can still do much business online on our Coronavirus Resource Center. All the different ways you can do business online or by phone or by email are listed there. As of right now, people are still in the offices, so we can actually do those responses. But again, this is an ever-evolving situation. As each day passes, we'll make changes on the fly as necessary. But again, email us, call us, and mail drop-off. We've in the front lobby of the police station, that remains open to the public, and that's there for obviously physically reporting emergencies to the police department, to the front desk, which is behind glass there. As well as dropping off items, could be sewer bills, could be a tax bill, could be a mail for a different department. Those are opportunities for you to come here and drop it off and then just and leave, and we'll be distributing that mail internally to the departments. Couple other things happening as well. As of today, the bathrooms in all our park facilities will be closed. While the parks are still open, a reminder that fields are closed. Permits have been revoked from those fields if they were already issued. Playgrounds, as the mayor mentioned before, are closed. That's again to stop the gathering opportunities, and it's being done for public safety reasons. And so we ask you to not step over the caution tape and adhere to that. We did that so there's be a physical barrier, but playgrounds are closed, fields are closed, parks are open for walking your dog or walking by yourself, but bathrooms will be closed as of today. We found that in our county call yesterday that the county bathrooms have had toilet paper and soap being stolen out of them. And of course, the employees who are cleaning them, that's a way that obviously the virus can spread. So we're following suit with the county and closing our bathroom facilities today. A couple other things that are happening from a town business perspective. Town council meeting is scheduled for next Tuesday, March 24th. That meeting will go on. We're actually figuring out now how we're going to do that meeting, both from a technology perspective to protect the council members and of course the staff. The municipal budget that was supposed to be introduced next week is being deferred. Reason is the state actually passed a bunch of legislation on Monday allowing for extending timeframes for various things, including budgets. no doubt that our revenues will be severely impacted by this shutdown of no court sessions, construction permits being down, lots of other things. So we have to go back and revise our budget to make sure we protect the town and protect the operations going forward. So we'll be doing that. The next meeting after the 24th at this point is scheduled for April 14th. So we're shooting for that date right now, but we're going to take guidance from the state as we move forward with that. And again, we're looking to expand remote options where we can, so more to come on that as well. But I can't stress enough, go to the website of the town, the Coronavirus Resource Center. We're updating it every single day with new information from public health to opportunities to contact the town, and also what's going on in the town from a town operations perspective. It's a good place to keep up on things. And again, our Facebook, Twitter, town updates. We've seen a huge uptick in people joining our town updates. We thank you for that. We're sad this has to be the reason to do that, but we're very happy for that. Join up for every single category you can, and as information comes out, you'll be getting a message pushed to you, and that's very important. So I think that's it for now, Mayor.
Great, thank you.
Thank you.
All right, Chief Badalora?
Thank you, Mayor. I've been meeting regularly with Chief Tiller from the Fire Department, Chief Guzman from the Rescue Squad. I'm happy to report that at this time we are providing full police, fire, and emergency medical services unabatedly. There are no interruptions or reductions to any service, any public safety service that the town is providing. All of our police, fire, and EMTs are self-checking themselves at the beginning of their tours of duty for any signs and symptoms of the virus, including taking temperatures. We are making sure that our workforce is healthy and that we're not interacting or having any of our officers with any signs and symptoms of the virus interacting with the public. We continue to revise and modify our response procedures to reduce any duplicity in service. At this point, it's essential that we maintain a healthy workforce. Additionally, we are reassigning our parking enforcement officers and our school resource officers to tend to the needs of the community. Our parking enforcement officers are paying special attention to the central business district to ensure that our curbside service requests are being handled in accordance with the mayor's directives. And additionally, our school resource officers, with schools being closed, they have been rededicated as community service officers to tend to the needs of the community. It's very important to me that at this time no one is forgotten about, no one is left behind. If you have a vital need or service that needs to be provided to, our SROs, our community service officers, will assist you in providing that good or service. I do ask that if you are capable and competent of performing it for yourself, that you don't put that burden on us. We will screen each and every request to determine if it meets our criteria for service. We have tended to some of our less fortunate citizens in town who are home-ridden and unable to get out in public. We've done some shopping for them. We've ensured that they've gotten meals, and we've set them up with some long-term services to help them. But I would ask that if you have the ability to perform that service, that task yourself, that you don't put it on us. We will deny requests for service that we deem are inappropriate, but we are doing everything we possibly can to make sure that no one is forgotten about in these tough times. I have complete confidence in our dedicated and professional workforce here, and I am certain that we will be able to continue to provide these services unabatedly. Thank you.
Thank you, Chief. And let me just follow up on one thing too, because with so many offers of assistance, we anticipate, we've been talking to the Westfield United Fund, and we anticipate shortly that we'll be setting up a fund through, the United Fund will be setting up a fund specifically to assist those in need, potentially displaced workers and so forth. So we're having a call with them later today to figure out the logistics of that. And once we get all that set up, we'll be sending out an announcement to the community and figure like that will be the best way to help. We will be using that fund to buy food as necessary, gift cards as necessary, small loans as necessary, whatever that may be, but we're going to be setting up the parameters and qualifications with United Fund. So more to come on that, but I think that's going to be the best way we can help. We're trying to avoid getting up volunteers to be interacting with the public. So as much as you might want to be delivering meals or whatever it may be, we're trying to actually streamline that through our police department. And the best way we could provide is that for them is probably through financial assistance to let us purchase the goods and essentials that people need. So going on to some of the questions that I received, And many of the comments that I've gotten from people were related to wanting to know more of the specific identities of the 3 cases of the folks that have confirmed cases. And let me just make a comment about that, and then I will send, and I'll read the specific questions I received, and then I'm going to ask Megan to comment. And this also was confirmed by Congressman Malinowski, who I just spoke to. The lack of testing everywhere has created a false sense of security in our community that this virus is very limited and contained. I think once the testing really ramps up, and we expect some drive-by testing sites to be open in Bergen and Monmouth County potentially next week, and then later evolve to other counties, you're going to see the cases actually double, triple, quadruple potentially. And what that's not to scare you, but that's the reality that we have. So asking for people's very specific information to know if you've interacted with them, you should operate as if many of your neighbors and interactions are already with people who might be contagious. And that is really why the social distancing is so critical. And what it's also meant to do, and this is what Congressman Malinowski and I spoke about, when those cases start becoming very public and numerous, it actually does not mean that the social distancing is not working. It actually, what we're trying to do is, you've heard the term flatten the curve. So we are actually trying to prolong this virus so that actually the spreading slows down, so we don't overwhelm our hospitals and healthcare workers at once with just an abundance of cases simultaneously. So you're going to see an explosion of cases initially, and it's only because the testing is now prevalent, but that does not mean the social distancing isn't working. So I just don't want anybody to be alarmed when that happens. We're fully anticipating that to happen, and that's why asking for the very specific identifiable information, first of all, it's not legally allowed, and we've actually gotten requests from some of these patients to specifically mitigate any information that might make people to identify them, as they don't want to be perceived as pariahs, but they have been taking their own social distancing measures for sure. So with that in mind, I'll just ask 2 of the questions in that regard that I received, and I'll let Megan answer it. When will you disclose the locations of the individuals who have the virus in town? It is a breach of your public fiduciary duty not to act in a reasonable and prudent manner to enable citizens to stay clear of the virus. And HIPAA does not prevent a disclosure from protecting the health and welfare of the general public. Such non-disclosures intentionally harming other citizens and opening each member of the town board to personal liability.
Thank you, Mayor.
Well, let me ask, hold on, there's another one on the same vein. With regards to the 2 males, middle-aged males in their 40s that currently have been identified as confirmed cases, can you confirm whether they did or did not attend either of the 2 daddy-daughter dances that took place on Sunday, the 8th of March? Can these types of details be shared?
Thank you. So I think that it's really important to remember the exact messages that the mayor just shared. The 15 cases I believe we currently have in Union County by no means is a true representative of the amount of virus infections we're seeing in the community. So we want to make sure that residents really practice these social distancing measures with everybody. Hence the need for the department to say at this point we are discouraging play dates as well, right? We want to make sure that people are social distancing as much as possible. To the specific questions about releasing where individuals were, this is still protected under patient privacy laws, and it's very important to us that the identities of these individuals remain anonymous, because number one, that's the law, right? And number 2, we can't release any identifying information. By starting to release where people were, at what times, along with their age and their sex, I strongly feel as a nurse that is or could be identifying information.
And while we have you, Megan, a couple other ones. Can this virus be transmitted back to animals like a pet or a dog? Can a bird transmit it?
So from my knowledge, as of today, I do not believe so. But again, that's from my knowledge as of today.
And, okay. If I am cooking or baking for family, disinfecting and cleaning along the way, should I be worried about transmission from food items?
Nope, at this point, we think it's completely fine.
Is it okay to walk outside as long as we stay at least 6 feet away from other people?
I think not only is it okay, it's recommended. The weather's starting to get better. I think a little bit of sunshine could do us all good. So if you want to take a walk outside, as long as you keep your social distance, I think it also really helps with the mental health aspect. You know, just being inside the house for a long period of times, can be stressful in itself. So I would say if you can get outside and keep your social distance, the health department definitely recommends it.
Would it be feasible to include confirmed cases and updates for our surrounding towns, such as include Garwood, Mountainside, Scotch Plains, and Clark?
So we do have the county cases. So those are updated by the state website. I think it's important to also remember that starting next week, when the drive-through testing starts, the cases are really going to exponentially increase dramatically. So for the health department to update in real time, I don't necessarily know that would be realistic.
I've gotten a lot of information about grocery stores, and one specifically, what is the status of shopping for seniors at grocery stores? So this is what we've gotten from I can repeat what we've gotten today. So ShopRite, Stop and Shop, and King's have dedicated the first 2 hours of opening each day for senior citizens. Now, I don't think there's not police enforcement in that regard, but I think the expectation is that the public will oblige, and if anyone else feels that they're vulnerable or immune compromised, I think it's okay for you to show up there too, but let's be sure and give the seniors the opportunity to shop. And I do know that the managers there are also very cognizant of the number of people in the stores, and we want to obviously avoid lines outside, et cetera. And regarding Trader Joe's, they have modified their hours to 9 to 7, and they've emphasized that their focus remains on being good neighbors, which they always have been, and they're using discretion to let smaller groups into the stores at once to protect the community and their employees. So they want to know they are completing extra sanitizing regularly and using only every other register to put more space between customers. Another question I've gotten a lot about is daycares, and if daycare centers are going to be closed. It has been confirmed by the governor's office that I don't have the authority to close daycares. I've gotten concerned emails from both the employees of daycares and from residents. Many of those daycares are providing support for first responders and healthcare workers. That being said, Tom Malinowski was on his agenda to speak to the governor about today. So maybe there's a solution there that we can, where those children of those essential workers can be cared for. Also, but being mindful of the greater public health. So more to come on that, but please know it's something that we're very, very mindful of. Let's see. Oh, someone asked, can we centralize information on business hours and special arrangements for like the grocery stores and other things so that people don't have to search businesses essentially? We're going to attempt to do that and link. I know the DWC on their website is taking care of all the businesses downtown, but we'll do the best we can in that regard too. So all that information is a central place. Okay, how should we mail packages that we normally would take to the post office or UPS, especially if we want to send, care packages to families? And I'll give you my thoughts on that, and Megan can weigh in. I know all the handlers, certainly ours and most at those facilities, are using gloves and are sanitizing. So I think as long as you're using the appropriate sanitation measures for things that you put in a package and how you handle the package, I think that's fine. There's a lot of essential goods traveling through UPS and the post office, so they're still in operation, but I think they're safe as long as you're practicing safe practices and hand off when you actually deliver it. Is that correct, Megan?
Yes, I agree. And, we should be washing hands as much as possible. So I think that's absolutely correct.
I think, Mayor, the UPS store downtown contacted the Downtown West Corporation, and they're putting their own protocols in for how many people in the store at a time.
That's
They
right.
want to encourage people using the mail, but
Yeah.
they're having their own precautions for their own employees.
And I know I saw them yesterday. They're actually doing also curbside pickup and delivery at the UPS store downtown. So they're mitigating. I know if anybody was in the store, they weren't going to allow more than one person in the store at a time. So those are all the ones we got in advance. Kim, do we get any?
A couple more. Megan, could you address what would constitute, at what level of fever someone should consider calling a healthcare provider?
And just repeat that question for people, Megan.
Oh, I'm sorry. So the question is, what constitutes a fever? When should you call your healthcare provider? So at this point, the guidance is any fever of any temperature of 100.4 or greater with other symptoms, whether that be a sore throat, body aches, cough, tightness in your chest. At that point, you should be calling your medical provider.
Okay. Mayor, regarding centralizing all of the business information, we have a question that not all businesses fall in DWC centralized district. Can other businesses send their info to us as well?
Can other businesses outside of the Special Improvement District that comprises the DWC? Yes. The Chamber of Commerce is also serving as a resource for that, so we'll work with them to make sure that there is a central location. But absolutely, please, whether you're in the SID or not, please send that information in as well.
We have a comment about, please address the ongoing house parties, basketball games in schoolyards, et cetera, how that pertains to social distancing recommendations.
Please, the question is, can we please address the outdoor basketball games and house parties and all the other stuff that should not be happening? I can't stress enough that, it's oftentimes, we oftentimes have a hard time saying no to our kids. This is the time to do it. And it's no socializing outside with other kids, no play dates, no sleepovers. I can't stress it enough. And please don't put us in the position of having to enforce that in terms of playground and so forth. Please explain to your kids, this is the time to put the foot down. It's really beyond inappropriate and unsafe for folks to do that. And we're just really counting on all of us as a community. And I will tell you, if you read the heartbreaking emails from our local healthcare officials who are on the front lines, imagine being an emergency medical physician driving to your hospital where you're on high alert the whole time. You're distancing yourself from your family not to endanger them. And you're driving by a playground in Westfield full of kids or a basketball court full of high school teenagers playing. How do you think that makes these healthcare providers feel in terms of how we value their work? So please, now is the time to tell them to cut it out. The more we do now, the shorter the amount of time frame that this will have to continue. So please, please, please.
And we have a question about how are we getting the social distancing guidelines out to people who are not checking online?
How do we get the social distancing guidelines out to people who are not checking online? We're relying obviously on a lot of word of mouth. I think, hopefully we've done all we can. I've certainly asked for the support of TAP to get word out. We're doing not only online, Nixle alerts, email alerts, and a lot of, social media, et cetera. So if anyone has any suggestions for other ways that we could be reaching these people beyond the ways we currently are, please do. But we really are relying on the word of mouth of our community to make sure people understand how critically important it is to honestly saving lives.
Mayor, I would say we're also using Nixle.
Oh, and we're using the Nixle alerts. And print media as well. And the Nixle alerts, which have historically been used to alert people to police emergencies, we're sending our daily updates through Nixle alerts as well, so which obviously come via text. So please, encourage the Nixle alerts so you can get these text messages to your phone, which provide those daily updates to everybody.
Is the Westwood United Fund the most important place to contribute for immediate relief for town residents and businesses?
Will the Westfield United Fund be the most important place to donate to support local immediate needs? That's the intention, yes. That's this, hopefully a streamlined fund where we can actually identify the need and get to it the quickest way. Hopefully more details will come out about that in the next day or so, once we finalize what that looks like with the United Fund. But that's the intent, yes.
Nothing else here.
Nothing else? Any other?
I just want to say about social distancing again. We're doing everything we can, as you mentioned, all the different resources we have, but you don't have to do anything but turn on the TV in your own home. Every station is talking about this, federal government, local governments, state governments. Social distancing is critical right now for everyone to practice to reduce the spread of this virus at a geometric rate. So my kids are home, they don't like it, but they're home, they're doing their homework, they're online, and they're not allowed to go out unless we're going for a walk. And it's so critical to adhere to that right now. And again, we're not here to scare anybody, but the realities are, the numbers we're talking about right now that Megan has mentioned, both in Westfield and in the county, are going to rise dramatically over the next few weeks. And we're prepared for that, and you should be as well.
And one of the questions I had for Congressman Malinowski is the projection of when do we think we'll be at peak contamination, if that's the right word, in terms of our hospitals. And he said they have a best, good, and worst case scenario. And it is absolutely dependent upon how well we do in this part of the phase. Will determine how big of a plague or a pandemic this is for our community. So can't stress enough, the lack of testing is giving us all a false sense of security. And that's I think we're gonna have a real new reality very shortly, probably next week. So again, it's not to scare you, it's just to know we're anticipating that, we're prepared for that, and you all need to do your part. And I've seen the best of all of our community. I think we will make the best of it, and it's hard because the social distancing is the last thing that most people want to do in times of distress. We want to come together as a community. We're just going to have to find very creative ways of doing that, and we're going to be focusing on that a little bit in the days to come once we get all the operational things out of the way and taken care of, so we can continue on. So, but we'll continue to send out our daily updates. Don't hesitate to reach out with your questions or concerns, and we'll share them with the community. But very grateful for the team we have here, and to all of you. So thank you, be well, stay safe, and be responsible.